order. I am in Ottawa today, sitting on the traditional unceded territory of the Algonquin people. Pursuant to Standing Order 1082 and the motion adopted on October 27th, 2020, the committee is continuing its study of food security in northern communities. To ensure an orderly meeting, remember to speak slowly and listen in the official language of your choice. There's a selector and that globe in the bottom center of the screen where you will select French or English. When speaking, ensure that your video is turned on, and please speak slowly and clearly. When you're not speaking, your mic should be on mute. Now, with us today by video conference for the first 45 minutes are the following witnesses from First Nations Food, Nutrition, and Environment Study: Laurie Chan, Lynn Barwin, Malik Batal, Tonio Sadik, and Konstantin Tikhanov. Mr. Chan, let me turn it over to you, and you can set up your speakers. And please go ahead for about 6 minutes, but a bit longer if you need to.
Sure. Thank you. Good evening, Committee Chair and fellow members. Thank you for inviting us to present our study results on food security in Northern Community to your committee. My name is Laurie Chen. I'm a professor and Canada Research Chair in Toxicology and Environmental Health at the University of Ottawa and one of the principal investigators of the study. The other co-PIs who are here this evening are Dr. Malik Batal, a professor and Canada Research Chair in Nutrition and Health Inequalities at the University of Montreal, Dr. Tonio Sadek, Senior Director of Environment, Lands and Water at the Assembly of First Nations, and Dr. Konstantin Tikhanov, the Section Head of Safe Food Environments at the First Nations and Inuit Health Branch of the Indigenous Service Canada. And Ms. Lynn Barwin, who is the project manager of the study and also based at the University of Ottawa. On behalf of the team, I'm talking about the results of the First Nations Food, Nutrition, and Environment Study. This is the most comprehensive, statistically representative study on nutrition and environmental health of First Nations ever completed in Canada. It is a true partnership between universities, Assembly of First Nations, and the federal government. This 11th study received over 12 million funding from Health Canada and the Indigenous Service Canada, and successfully collected data from 6,487 participants from 92 First Nations in 11 ecozones and 8 Assembly First Nations regions south of the 60 parallel across Canada. Out of the 92 communities, 37 of them were within 50 kilometers of main service centers. 39 were over 50 kilometers, and 17 were fly-in communities. Our random sampling strategies developed by Statistics Canada was adopted to ensure that the study results represent the diversity of the diets of First Nations. And we use a standard approach with identical tools and methodology so the results are comparable. The study is based on a participatory approach and was born out of the need expressed by the First Nations. Overarching First Nations support was received through a resolution passed by the Chiefs in Assembly in 2007 at the Assembly of First Nations Annual General Assembly. And the AFN participated as one of the principal investigating partners throughout the studies. At the regional level, before implementation of studies, First Nations regional organizations were consulted, as well as representatives from each participating First Nations were consulted as well. Regional chiefs approved the study and provide guidance on approaches to address the needs of the specific local environmental issues or concerns and logistical needs in their respective regions. All First Nations were involved in the planning as well as the implementation of the data collection of the 5 study components. They include household interviews, which collected socio-demographic, nutritional, health, and food security information. We also collected tap water sampling for metals, surface water sampling for pharmaceuticals, hair sampling for mercury, and traditional food sampling to look at contaminant levels. We believe this important information collected by the studies can be used by the First Nations, the risk assessors, and policymakers like yourself to develop effective initiatives to promote better health and well-being for First Nations. So we included an executive summary of the study in the package that we submitted to you. Next will be Dr. Patel.
Thank you, Laurie, Mr. Chairman, and members of the Commission. Good evening. We have summarized our findings on food security in the document to you entitled The Right to Food, a Coast-to-Coast Look at Food Security Among First Nations Living on Reserve south of the 60th Parallel. In brief, interviews to assess food security in our study were done using the Household Food Security Survey module, a tool used by Statistics Canada in the general population, making comparisons between First Nations data in our study and general Canadian numbers possible. We also compared the cost of a weekly basket of food in communities and compared it to the cost of food in a major urban center in each region using a standard tool, which is Health Canada's National Nutritious Food Basket. In all regions, food costs were often 2 to 3 times higher in communities more than 50 kilometers away from a major urban center and were even higher in fly-in communities. Prevalence of food insecurity was high in all the surveyed regions and averaged 47.1%, nearly 4 times higher than the Canadian prevalence at 12.2%. There was a south-north gradient of increasing food insecurity, reaching close to 80% in some remote fly-in communities. Our data on food cost and on food insecurity in remote communities show that existing federal programs have failed to reduce food insecurity in the communities where these programs are present. Since the food system for First Nations includes traditional food, our study used additional questions that address the barriers and enablers to obtaining traditional food. Almost half of all participating households worried that traditional foods would not last until they could get more. Issues of food insecurity among First Nations are compounded by problems of inadequate access to a healthy diet, leading to high rates of nutrition-related chronic disease and chronic disease risk factors. For example, rates of obesity are twice as high in First Nations on reserve compared to the Canadian population, 50% versus 25%, and diabetes 3 times as high, 21% versus 7%. Please note that our diabetes figures are based on self-reports, and this could be an underestimation of the true prevalence. On the other hand, traditional food, when available, can contribute greatly to the quality of the diet, even when present in small quantities. We showed that diet quality was much better on days when traditional food was consumed. 77% of First Nations adults in our representative sample told us that they would like to consume more traditional food, but are prevented from doing so because of government regulations, farming, hydro projects, oil and gas, forestry, and mining. Additional barriers they mentioned included time, resources, and knowledge, in addition to concerns over climate change and its impact on traditional food availability. Thank you. I'll let my colleague, Dr. Tonio Sadik from the Assembly of First Nations, to complete our collective statement.
Yes, thank you very much. It's a pleasure to be here this evening. We appreciate the opportunity to present to this committee on the study. We ask you to urgently address systemic problems relating to food, nutrition, and the environment affecting First Nations, and to do so in a manner that supports First Nations-led leadership and solutions. We held a workshop in Ottawa in November of 2019 to review the results of this study, which we call it Finesse instead of reading it out each time, together with the 280 workshop participants, including leaders and technical staff of First Nations governments and representatives of 70 of the 92 participating First Nations. We developed a set of recommendations. The document Key Findings and Recommendations for Decision Makers is included in the package that was provided to you. The following recommendations are related to the issue of food security, our main concern this evening, and I just want to highlight 5 recommendations. First, support communities to make their own informed decisions regarding food security and food sovereignty. Second, promote the consumption of traditional foods. Third, incorporate a holistic approach that involves addressing social issues and socioeconomic factors such as poverty, unemployment, and education that contribute to food insecurity. Fourth, support communities to increase their reliance on traditional food systems and build resilience against threats to food security or sovereignty, including threats such as pandemics, and we know what we're talking about there, and extreme climate events or disasters such as flooding and droughts and wildfires. Finally, fifth, ensure good drinking water quality and trust in the safety of public water systems. That's the end of our presentation this evening. I turn it back to you, Mr. Chair.
Thank you very much. That was really well done. And I know our questioners will be eager to get to you. So I have for 6 minutes in the first round, Eric, Larry, Madam Berube, Rachel Blaney, Eric Melillo, please go ahead for 6 minutes.
Thank you very much, Mr. Chair. And I'd like to thank all of our witnesses for joining us today. Lot of great testimony already, and I'll just try to get as many questions in as I can. One of the things that was mentioned, obviously, is how important traditional food is for Northern and Indigenous communities. I'm just wondering if, and whoever wants to speak to this, I'm just wondering if you could speak more to ways that the government can help support Indigenous people, the Indigenous people in their ability to harvest traditional food and to have that true food security.
Yeah, perhaps I can begin. Thank you for the question. I want to stress that perhaps the most important facet in recognizing the importance of traditional food is the recognition that traditional food is not just about nutrition, where nutrition is of course extremely important and is a factor in numerous ways, and the Finesse study is focused on that centrally for sure. There's a recognition that traditional foods, or there must be a recognition that traditional foods cannot simply be substituted by store-bought foods. There are a wide number of reasons why that's the case, and perhaps committee members are already well aware. But let me just very quickly note that apart from nutritional considerations, which are also a significant factor, the role that traditional food plays for First Nations is critical in cultural terms, in terms of the practices of food gathering, in ceremonial terms. Food in this sense, traditional food in this sense represents so much more than nutrition. And when traditional foods become unavailable or scarce, or if people are worried that there are safety concerns, which in most cases there are not, then we see a breakdown of sorts in all sorts of related social systems that really underscore the importance of traditional food for nutrition and for so many other reasons. So I'll stop there and see if any of my colleagues want to add.
Thank you, Tonio. I'll just add that for all the reasons that Tonio mentioned, we cannot replace traditional food with market food. And on top of that, the market food that is available in communities based on our study and many other studies is of poor quality. And this is a combination of issues of access and issues of financial access at the population level. So these are compounding factors that make the alternatives not interesting in many ways, as Dr. Sadik mentioned, but also particularly in terms of nutrition. And as we mentioned in our statement, what we are seeing in terms of chronic disease is major. When we have 3 times the rates of diabetes, this is very much concerning to all of us. Thank you.
Thank you. And I would like to get one more question in as well. You mentioned as well about remote communities and obviously the unique challenges they face. I have many remote and isolated First Nation communities in my riding in Northwestern Ontario. So again, to whoever would like to speak to it, I'm curious if we can talk more about what sort of infrastructure and transportation investments you feel should be prioritized by the government to help bridge that gap in terms of getting goods to the remote communities.
Marta, go ahead first.
I can go, yes. Well, I think based on what Tonio mentioned, I think it's not only an issue of getting the food there, but also of getting greater access to traditional food that is available in the environment and making sure that remains available. We mentioned the barriers that people have mentioned in terms of their access to that very healthy traditional food. So I would start by removing those barriers first, and then when it comes to providing access to other foods, many communities have their own solutions, and I think those need to be first sort of explored and discussed with them. Some communities have subsidies for traditional food harvesting. Others have gardens, and others have their own stores. So I think the answer might lie there, but I think also it's financially the government could support these initiatives much more than it does now. So in terms of subsidies, as we mentioned, in communities where the Nutrition North is present, the prices are not really much lower than when it's not, in places where it's not present. So I think those programs need to be thought over and perhaps subsidies increased so that access to healthy food can be improved.
About 20 seconds, Eric.
I'll cede that to you, Mr. Chair.
Thank you very much. My speaking order is now Marcus Pawlowski for 6 minutes. Go ahead, please. Marcus.
Sorry. I was really interested in the recommendations that came out of the study and some things that weren't on the list. We heard from one of the chiefs in NAN, the northern communities, in fly-in communities in northern Ontario, and he certainly talked about the high price of food and the fact that in many places there was just one store, giving kind of a monopoly to one provider. Did your study and do you not think that is one factor in food insecurity in these communities, the fact that there isn't any competition, that there's only one provider with basically a monopoly on sale of foods? Mr. Battelle, maybe? I don't know if someone else is better.
Sure, I was just letting others speak if they wanted to. I think this is a very valid point. Often in communities, the competition is non-existent. However, as I mentioned earlier, this is but one aspect of the problem. What we have found, for example, in our analysis is that it depends really also on the household and their ability to access the food. So if you have households who are on social assistance, if you have households with people who are unemployed, these people have much harder access to healthy food. And we found a clear association between those instances and food insecurity. On the other hand, and this might be an interesting observation, in households where there was an elder, there was a person who was on old age pension, food insecurity was lower. So there are issues that are not just at the store level. Definitely these are problems and subsidies could help with that, but there are also social issues and poverty issues that are at the community level and the household level that contribute to the problem by limiting the financial access to healthy food.
Well, that's probably a good segue into my second question. You mentioned that there's twice the incidence of obesity, 3 times the incidence of diabetes in First Nation communities, and having been a doctor that's worked in such communities and lived in such communities and know the cost of things, is not one of the problems the fact that the affordable foods are often not the healthiest foods, pop, chips, canned stuff, and is one of the solutions perhaps not that we don't give enough subsidies for good kinds of foods, which would address the underlying dietary problems leading to health problems?
Absolutely, and I think also, like if many of us have been to many communities, and the more remote the community, the smaller the store often, and the more it looks like a convenience store more than anything else. So I think that's a problem of food environment. You choose to consume from what is available to you, and I think that's a major issue in many communities. Regardless of people's knowledge about food and capacity, there's also the problem of availability of the options, and so there probably should be more subsidies for healthy food, and perhaps greater competition if that is the answer. But often in small communities, there's no room for more than one store in terms of the population size. So would that be always an obstacle to better prices? I don't know.
Do I have more time, Chair?
2 minutes.
Okay. Another thing that I noticed wasn't in the recommendations, but one of the things you stated in coming out of the study was that half the people thought that the traditional foods that they had wouldn't last until they got more. That suggested to me, or I've got this wrong, the problem is with storage and refrigeration, and ought we be doing more in terms of communal refrigeration and storage to address that particular problem? I think some places have, in fact, done that and been quite successful in having like freezers where people would bring a moose and the moose would be for the whole community.
Yeah, I guess I can answer that. Yeah, we have visited many communities, and Dr. Patel said many of them have their own solutions. And one of our common solutions is to have a communal freezer and a communal harvest program, so that the elders can take the young kids out for hunting, and then then store the food in the communal freezer, and then share them when the communities are whoever is needed in the community. So again, we emphasize that a lot of the solutions can come from the communities, but a lot of times that they don't have the resources to implement them. So government programs that can actually support the local solutions will be probably the most effective solutions.
Just 20 seconds, Marcus, just about time.
And are there presently resources that would allow communities to acquire freezers for that kind of thing?
Yeah, some programs available. Each community have to apply to them themselves. So sometimes the challenge is that they spend a lot of time putting proposals together, and some communities may not have the capacity to do those proposals. So capacity building is also another challenge that we need to look at. So when we roll out programs, we need to consider that some communities may need more help in assessing those programs than the others.
Thanks very much, Mr. Chan. Mr. Pawlowski. Madam Berube, 6 minutes. Please go ahead.
Thank you, Mr. Chair. I represent Abitibi James in Quebec, riding the Acris and Ishitamek. So I represent them in my broader riding. So here is my question to the witnesses. You mentioned that after your study on the food, the traditional foods, there are issues of cost, transport issues. So what recommendation can you come up with to improve the diet quality?
Merci, Madame. We found that traditional food was higher in terms of nutritional quality than market food. So greater access to traditional food would be a step towards greater nutritional quality in the diet. There are also issues of access in terms of the healthy food within the communities. As described earlier, many communities have one store which doesn't always carry the healthiest food, and when the food is there, let's say fruits and vegetables, and that's anecdotal. We didn't measure that in the study, but we have seen it, all of us, as we went back to communities to report results or to do the study. Fresh fruits and vegetables do not stay fresh for long, and the quality is often very compromised, and you don't want to buy them, those fruits and vegetables, at the prices they're at. And even if they were much cheaper, there's a problem there of transportation or whatever it is, or a problem of logistics that makes it very hard for those foods to arrive in sufficiently acceptable quality for people to want to consume them and pay the high price to do so.
Several communities mentioned that they are not satisfied with Nutrition North Canada. What comments do you have in relation to the dissatisfaction expressed by communities?
If no one else, I'll take this one too. We are not the first ones to mention Nutrition North and to mention that doesn't seem to be working well for communities where it is implemented. There are many reports that started coming out. I can mention the UN rapporteur in 2013, and then lately in 2019, there was a study also that looked at Nutrition North. And what seems to be clear is that we don't know how the subsidies are getting or are trickling down to the consumer. And I think this is the main issue. And when we look at things such as the Feeding My Family Facebook page, for example, that was happening in Nunavut and other places, in many instances, Nutrition North was present in communities, and people were posting very high prices for milk and meat and other essential foods. There are issues with the subsidy program, clearly.
I also have a question. When we are mentioning women, children, seniors, handicapped people, these people are also more vulnerable within the communities as far as food security in northern Canada. So could you tell us what statements can you make in relation to that particular issue?
If I could, I would just say that local solutions are the appropriate response to not only that question and that challenge, but I think all of them that have been raised. The idea that we need to look externally about how to get other foods into communities, how to reduce those costs, and to make sure that they're foods that are attractive to people living in those communities is only a small part of the challenge. And my sense of what we have come to understand as a result of the study that we've been involved in is that by focusing on traditional foods and access to those foods and good information about them, we deal with a weed of issues than simply the issues that we hear quite commonly about foods in northern and remote communities that relate to, getting food in there and the cost of pop versus other foods or beverages. So, I think local solutions are such an aspect of trying to answer these questions.
That's all our time, Madam Berube. Thank you, Ms. Blaney. 6 minutes. Go ahead.
Thank you so much, Chair, and I want to thank everybody so much for your testimony today. It was very informative. My first question, of course, I'll leave it open to any of you. I know you're the experts in this. But one of the first questions I have is around Nutrition North. I've heard this from other testimony, the concerns about transparency, the reality that the connection to what's happening in the communities is not there to the degree it needs to be. And actually, President Obed from ITK talked about what he thought would be an important transition to move it from a subsidy program into more of a social program, so that the resources that were going out to the communities were more reflective of the needs. He talked very clearly about some folks having more resources and others having less, but there being sort of an even playing field, which really led to a lot of low-income people not being able to access appropriate food. So I'm just wondering if you could speak to any thoughts that you have, or any witness testimony that you had through your research that may reflect those particular challenges, and if you heard anything similar.
I can add to that. We have heard a lot of concerns from the community expressed that the decision for what food is stocked in the local store is not transparent, right? So it's often made by the supplier down south, or even a store manager that is not from the communities. A lot of times they voice the concern that the food they stock is primarily based on profit, but not other decisions, right? So I think the main, we keep emphasizing the point, is that the governance is the issues. Who is making decisions on how to spend the subsidy, making the subsidy transparent, so people know that the subsidy is well spent for the needs of the community.
And I've heard concerns that monopoly for these stores, and that's not really reflective of the needs. So Mr. Patel, sorry to interrupt you. I saw you were about to end.
I just wanted to have to give a quick answer and apologize for having to leave because I have another commitment. And my answer has to do with something you alluded to in your question about the ability to purchase the food. And I think that's probably where our attention should go, rather than subsidizing something that the people do not have control over. Perhaps aiding families to actually be able to afford food, whatever the food is costing. And I think that's where subsidies would make more sense, because that gives back freedom to people to choose the food that they like, and that is sort of in harmony with their beliefs and what they want to consume. So I think that's a big debate, and I'm sorry I have to leave as I say this, but I think that's where the government could be switching the financial contributions from stores to actual families. And that's what we saw. We saw that families who are on social assistance are having the hardest time being food secure, and families with children have a hard time being food secure, even though parents shield their children from food insecurity. So the children are not food insecure themselves, but the parents of children are more food insecure than people who are not parents. So I think that's where the major issues are in issues of families being able to afford the food, no matter what the food costs.
Well, and I found it quite startling in your testimony where you talked about families that have somebody with old age pension having more food security, and I don't think that's often what people think of. So thank you so much for your time, and I'm really sorry to see you leave. The next question I have is around climate change and impact on to traditional food. We've heard a lot of testimony of people talking about how they used to be able to harvest different types of food, but because of the changes in the climate, the reality that the ice isn't staying as long, it's not as strong, really providing challenges. They're not able to get that. And so I think about, the high costs of food, plus now not being able to hunt and gather the way that they used to. And even discussions about Nutrition North used to have provisions for people to be able to buy things like bullets to go hunting. And now that is completely off the table. So I'm just wondering if you heard anything about that in your study and your thoughts on climate change and the impacts.
Yes, and so we did ask the participants, what are the barriers for them to get out to get more traditional food, because almost all of them, majority of them mentioned that they would like to get more traditional food but cannot. So climate change has been mentioned as one of the top 5. The others are like government regulations. They cannot fish or hunt because of government regulations. Also, industrial pollution has been mentioned as well, chemical pollution. And one of the other concern is the perception of the quality of the food. when people see the food is not as good, well, it doesn't look the same or taste the same as they had before, they will refrain from eating it, right? So support on more about education, addressing some of these local concerns can help to change the perception or try to resolve the problems that we can sustain or maintain the quality of the food so that people have confidence eating the food.
Thank you very much. Thanks, Ms. Blaney. Panel, we're coming up to time, and I'm going to ask each of the parties, if we limited to one question each with Mr. Schmale, Mr. Van Koeverden, Madam Berube, Ms. Blaney, that might get us close to the time we need to get off. So, Jamie, would that be okay with you to ask one question rather than 5 minutes, because that would pretty much take up the whole time?
Yeah,
okay, go ahead.
Yeah. Okay. I guess my question, we heard a lot about quality. We heard a lot about access. We heard a lot about problems with the subsidy program. It works. It doesn't work. There's problems. Has there been any organizations or any discussion around the actual growing of produce? And obviously with the temperature, you can't without warehouses, something I've seen massive greenhouses in different climates that worked in cold, worked in warm. That way you don't lose the nutrition that it takes for the shipping and the time and the short shelf life and all that. And it might also create jobs in the agriculture sector up wherever we're talking about. I know we've got people from all over the north, but that's, I guess, my question. Are we talking about actually growing it there and allowing people the freedom to have the foods they want?
Yes, when we report the results back to communities in Saskatchewan, we heard that they have got very successful program helping local communities to set up greenhouses to grow home produce, and that has been very successful. So, and of course, in other communities that when the climate, allows them to grow their own produce, they are quite successful as well. And and we were asked to test some of the local soil, for example, to make sure that the homegrown produce are safe to support, the vegetables or fruits that they harvest locally. So if it's identified as one of the potential local solutions, definitely worth supporting.
Because then all the other issues don't have to worry about, like the climate change, everything. You have it there. Sorry, Chair. Yeah.
Thank you so very much, James. Mr. Van Koeverden. Adam?
Thank you, Mr. Chair, and thank you to the witnesses. This has really been extremely interesting today. I appreciate the insight. My question is also concerning climate change, as well as the potential contamination from Arctic oil drilling. I know that we're talking about maybe some more southern jurisdictions, but can we talk about the potential for contamination? We're talking about living off of the land and living off of an ecosystem which is fragile. Arctic ecosystems and subarctic ecosystems have been shown that they are more susceptible to climate change, and they might also be more susceptible to contamination from Arctic and subarctic oil drilling. Have these things been taken into consideration much?
Yes, I think both climate change and chemical pollution from industry or not are similar issues of environmental degradations. Some of them are more close by, some of them are more long range, happening elsewhere. So we cannot let the local people to suffer because of our irresponsibility in handling chemicals, etc. Right. So I guess when we do all the big decisions in allowing an industry to go ahead or not, definitely the whole issues of food security or the way of life of people, the well-being of the people needs to be considered and weighed heavily in those decisions.
Thanks very much. Yep. I'm sorry. Adam, thank you for that question. And Madam Berube, your question, please. Go ahead.
Merci, Monsieur.
Thank you, Mr. Chair. My question is, what are the factors that came out, as far as you're concerned, that relate more to food insecurity that cause that problem?
Yes. Well, when we keep emphasizing the food security issues, is not just buying market food or not, right? So the inability or the lack of capacity to get the safe, nutritious, traditional food locally is more important, right? So ways that we can actually help them to access more local traditional food, or solutions to so that they can store or share traditional food, will be more effective solution than subsidizing import food to go into communities. That's our thought.
Thank you very much. Yeah. Thank Ms. Blaney, your question?
So my last question is around the government regulations. You talked about that being one of the challenges. I'm just wondering if you could speak a little bit more about what those barriers are specifically.
Well, the lobster industry, for example, remember that incident in Nova Scotia. There's similar, seasons of harvest, etc. That may be in conflict with people's traditional practice, right? Quotas set up for the different fish or sea mammals, etc. Right? So sometimes the policy are developed by the government, DFO, etc. They may not agree with the traditional knowledge or the local observations. So those are some of the issues that we heard that are quite common.
Well, thanks very much. And thanks to all of our panelists. This is brilliant. We have your submissions, of course, which we're enjoying going through. But due to the time constraints of especially tonight's meeting, I apologize for not allowing us to go on. Such interesting and such a great panel. But we have another one coming up as well. So we will now suspend for a few minutes to go our second panel to get prepared. And once again, thank you all for a wonderful presentation. Thank you.
I want to acknowledge that I'm presenting to you from Treaty 6 territory and homeland of the Métis. My name is Carrie Verschegen, and I'm a registered dietitian and the director of the Eat Well Saskatchewan program, which is a service that operates out of the College of Pharmacy and Nutrition at the University of Saskatchewan. What foods are safe to feed my baby? Our child has just been diagnosed with celiac disease, and there is a 3-month wait list to see a dietitian, and we don't know what to do. I just found out I have diabetes and I don't know what to eat. I am so lost. I can't afford to feed my family. What can I do? These are real examples of questions we receive every day. Among all the harmful misinformation that fills the internet and the fad diets that are heavily promoted by the diet industry, there is one thing for certain. Canadians are confused about what to eat, and many lack the skills needed to meet their basic dietary needs. On top of that, many Canadians, even more so living in the north and remote communities, face further barriers that ultimately affect their ability to access safe, affordable, and nutritious food. If I told you that you had to spend $18 to purchase one pepper or $20 to buy a 4-liter jug of milk, would you buy it? Now imagine you're on income assistance, $155 a month to cover food and expenses for your family. To that question, but these are the realities of people living in northern Saskatchewan when food costs 30% higher than the provincial average and 70% higher in the far north when income is also substantially less. There is no denying why people spend their food budget on more lower cost processed foods that are full of excess sugar, fat, and salt. They are affordable, they are accessible, and although nutritionally inadequate, they meet immediate hunger needs. People cannot access proper foods they need to nourish their families, and as a result, experience higher rates of chronic disease such as heart disease, diabetes, obesity, and depression. A recent study estimated that the economic burden of not meeting food recommendations in Canada was $13.8 billion. As the only regulated food and nutrition professionals in Canada, registered dietitians are the most qualified healthcare professionals to meet people or to help people meet their nutrition needs. Unfortunately, access to dietitians in rural and remote communities in Saskatchewan and other parts of Canada are often extremely limited or non-existent. Here's where Eat Well Saskatchewan comes in. We cannot change the burden of high-cost foods for families, and we cannot change income. Government policies are needed to address food affordability and availability. But what we can do is support families to make their food dollar go further in 3 ways. Firstly, we can educate people on lower cost nutritious food to eat healthy on a budget. Secondly, we can support initiatives that encourage more traditional food practices to grow and access more food. And thirdly, we can help develop necessary food skills to help people cook and prepare nutritious meals to meet their basic needs. Eat Well Saskatchewan allows people access to timely, accessible, and free nutrition advice from anywhere in the province by use of a telephone or an email. We provide people with general advice, we can link them to community services, and provide credible resources. It doesn't matter if you're in a remote location or a city center. If you have transportation or childcare, we have eliminated these barriers. At a critical time when people have been isolated due to COVID-19, when health professionals have been deployed and many essential services cut, Eat Well Saskatchewan has stepped up. We have remained accessible and filled a big gap. Our current funding allows for one dietitian to provide services from 10 a.m. to 4 p.m. 4 days per week. Despite the limited hours and dietitian time, we have responded to over 1,100 calls and emails from the public in more than 100 rural, remote, and Indigenous communities in Saskatchewan since our launch in 2019. We are more than just a contact center. We are a centralized nutrition information hub for the entire province. We can teach thousands of people basic food skills, food budgeting, and meal planning ideas from the click of a button by using our social media channels, in which we have already reached over 400,000 people. We creatively have utilized Indigenous storytelling to engage an Indigenous audience across the province and have motivated people to make positive change. We have collected and shared local success stories to help residents cope with the food security challenges of the pandemic. Collectively, we have launched campaigns that have reached over 200,000 people. I want to leave you with this. In 2 short years, Eat Well Saskatchewan has made a difference to thousands of lives. We are changing the way communities think about food. We are building trust within the medical community, and we are filling a need. Every day, I hear from people across Saskatchewan that talk about the benefits of having this service. We are helping residents to develop food skills, to manage chronic conditions, and to eat within their means the best they can to feed their families. We have made and continue to make important Indigenous connections, and our reach to Indigenous, new immigrant, and remote communities continues to grow. The potential for this service is way beyond our current funding capabilities. And as a service that has managed to reach thousands of people with one dietitian on limited funding and limited hours, imagine the possibilities of what we could do with more. Thank you.
Thanks very much, Ms. Verschegen. And now, speaking as an individual from the University of Laval, Monsieur Gérard Duhaime, please go ahead for 6 minutes, Monsieur Duhaime.
Merci.
Thank you, Mr. Chair. I'm a sociology professor at Laval University, and for several years I was managing a major research project on food security in the Arctic territories, in the north of Canada, in Alaska, and even in some Scandinavian countries and the Russian Federation. To carry out this study, we used the same definition you are using today for your committee work, and I would refer to that definition just to give you some of the main conclusions on some of the factors at issue in food insecurity in northern areas based on conclusions that have been made in northern Canada. So I will mention 3 major factors. These are factors that are cumulative. They cannot really be taken in isolation. The first factor is access to resources. As the team of my colleague Chan mentioned, and with some of his collaborators, climate change, pollution has an impact on people's capacity to have access to food resources. And so it actually reduces the amount of food in the stores. The issues of food safety and health, these issues are impacted by pollution that comes across by the sea in the north. Our team was able to bring out some of the related factors. Now, as far as this access to resources, another thing is competition with other users of the territory. For example, in most of the territories in the north, there is non-Indigenous hunting and fishing and some recreational activities. In the commercial fishery, specifically it's sporting activities and recreational activities on the territory that can sometimes limit access by the Indigenous population. And on several occasions, we have seen that these issues have created significant problems. The other major obstacle is that, which highlights the situation in Aboriginal or Indigenous households that are trying to produce their own food. And some of the extractive industries, especially for hydroelectricity, mining activities, and other extractive industries have an impact. These difficulties are very significant. We see them practically everywhere in the northern territories. And the other issue we noted was that the market doesn't really work there. Although we act as if things are flowing normally, that there is competition and flow of information, that's not true. The markets in several communities don't have sufficient roads, and even where there are good roads, the market doesn't really operate because there are very few businesses around. And most of the businesses are, of course, there for profit reasons. And the maritime transport is not often smooth in the north compared to what you see in other areas like Alaska, Greenland, where every a small village has a deep sea port. And finally, the air transport in all these communities that depend on their food supply during lengthy periods of the year on air transport. These communities are living precariously because often there is only one airline that serves them. Sometimes all it takes is one significant defectuosity for them to suffer. The third major factor, which is cumulative, it's access to food resources. And this factor is directly linked to poverty, to the average salary in the North. We have observed in indigenous territories like Nunavut and Inuit territories, in Northwest Territories also, Nunavut in Labrador, Inuit in Quebec, it doesn't often take into account the food cost. In the official statistics, we find poverty rates that go from 15 to 20% without including the food cost. When you include the food cost, the rates vary between 30 and 40 and sometimes 45%. So on average, it's about 37.5 on average, based on the last survey. So the average is 37.5% of indigenous Inuit households that live below the poverty line or the low income line. So this situation, which is very serious, causes serious problems within the households in terms of getting provisions from the stores. The costs are very high. As my colleague Chan and his team mentioned, some of the costs about 150 to 200% higher. So, and it makes everything difficult in terms of self-production or hunting and farming.
Sorry to interrupt. We'll pick up some things as through the questions. We'll be able to get, I think, the first 6-minute round completed before we have to sign off. So Gary Vidal, you're up first. You have 6 minutes.
Thank you, Mr. Chair. I want to thank both witnesses for attending tonight and for your valued testimony. I'm going to have a few questions for Ms. Vereshchagin tonight. I wanted to say Carrie, and I'm not sure we're on first name basis yet, Carrie, but I want to congratulate you on the great work that you're doing. My colleagues and I were actually just exchanging some messages about people taking new approaches and not just talking about failed programs and some of the frustrations. And obviously your organization has done that and is doing it effectively from the information that you shared. I know I read your brief and you might want to expand a little bit on your Eat Well COVID-19 campaign or your Eat Well Champion campaign a little bit, but you've been obviously doing some great work in Northern Saskatchewan and Saskatchewan in general. One of the consistent messages we hear on this study is the difficulty in accessing northern or remote communities, and obviously you've overcame that in some unique ways. I just want to let you expand for a minute on how you've overcome some of those barriers. Just talk a little bit more about overcoming some of those barriers of accessing northern and remote communities, please.
Sure, great. Thank you for the question. So I guess that is one of the big benefits of this program is that we are accessible from anywhere. So some of the things that we have done to expand to different communities. So we have done, like you mentioned, the Eat Well Champion campaign, and what this was we have featured different Indigenous champions from across the province, from communities across the province, who tell their own story. So it's by Indigenous for Indigenous. So we let them tell their story about how nutrition has impacted them, and those have been really popular throughout the Indigenous communities, and they have been shared a ton through social media by Indigenous communities, Indigenous organizations, and they have really helped to build trust within this population. So that is one thing we have used. Unfortunately, with COVID, we were gaining some momentum there. We did have to put a little bit of a halt to that. But we were also, attending different healthcare professional workshops, like working with healthcare professionals, because I think that is another really important part of this service, is that it's not just for the public. So we often field calls from healthcare professionals as well. And some of these northern communities, might only have a dietitian that travels out there once or twice a month, but many of them have nurses that are in the community every day. And so some of these, clients that might have nutrition questions, the nurses or the physicians can call us directly. So we have, broken down barriers like that as well. And yeah, I think just with more funding and more time, we're still new, but we are getting calls from the north and a variety of communities from the north that are hard to access. So I think that that's great. And with more time and more exposure, just a lot of people still just don't know about us. So, with more exposure, if we had more funding, that we could have more dietitian time to actually go build some of those relationships and build some of that trust, then I think that there's huge potential for expanding some of these northern communities.
Thank you. I was going to ask you, my next question was to be ask you about the opportunity to expand your program if that opportunity arose, and what that might look like. But I think I want to expand my question a little bit beyond just what that looks like in Saskatchewan, so that you and I aren't just looking after our home territory, so to speak. Do you see the work you're doing being able to be replicated in other provinces and other places across the country? Is the success you're having easily replicable, so to speak?
I think absolutely it is. I think it's important to note that some other provinces do have dietitian call centers already.
Okay.
I think Manitoba has a dietitian, BC, and there's one on the East Coast, but they're a little bit different. They are completely funded by the provincial health regions. So ours is a little bit unique, that we do have funding coming from Indigenous Services Canada and the university. So regardless of kind of how it's set up, I think this is definitely a service that can be replicated in other provinces. Just with COVID, we are seeing a big trend towards more virtual care. It is breaking down barriers. We can access a lot more people in a day. And I think there is a lot of resistance for people to access service because, they don't have the transportation to get there. They don't have the childcare, when you have 8, 9 kids at home, so we can offer services quite easy, and it's a lot more cost effective for the government as well. I'm one dietitian that is providing this service.
Thank you. Now you serve all of Saskatchewan. You serve all of the southern components of Saskatchewan, all the way up into my riding from border to border, and all the way to the north border. I want you to speak a little bit about the differences between the services and the opportunities you have serving people in the southern communities to those that we would call northern communities, or up in my area, and then maybe specifically to the fly-in, or the ones that we don't even have road access for. Just maybe kind of lay out some of the differences in your experience in those 3 kind of examples.
Can you do it in 30 seconds, Ms. Vereshchagin?
Okay, I'll try. Well, a big part of our service is also linking people to community resources. So, if somebody calls and they're having trouble feeding their family, we can link them to food banks. We can link them to community gardens and community kitchens that are going on. There's definitely a lot more services available in the South. So having, more of those, there's a bit of a disparity there. So I do find it a little bit more challenging sometimes with some of the northern communities, and people do call and they want to talk about how to eat better on a budget, but sometimes there's just not those options available. When it is $16 for a red pepper and you're living on a minimal income, those are some challenges that are definitely a lot different from the far north than here.
Thanks very much, and appreciate that. Mr. Bagnall, Larry, go ahead, 6 minutes.
Thank you very much, Mr. Chair. And my riding's in the Yukon, the far north. I'm calling from the traditional territory of the Kwan and Dun First Nation, the Taw and Quashan Council. And because of the north, this is very important to me. So I thank the committee members for allowing me to visit. And it's a really productive, positive committee. That's great. Professor Duhem, my question is, I think the committee is convinced that country foods is a great bonus when it can be provided. We've heard that years ago. We heard that recommendation, and in fact, we put in a new program a couple of years ago that supplies costs to get country foods. So people are preaching to the converted. But the conundrum I have is there's a balance between the eradicating a species when there's not enough country foods. And I'm just wondering if you could tell us some examples from Arctic around the world that you've seen where First Nation or Indigenous people have come up with creative ways of enhancing or make sure there's enough or more country foods, whether it's plants or animals, to get the supply up, because everyone thinks as much as they can have is beneficial.
Merci pour la question.
Thank you for your question. The answer I can give you is quite simple. It's just allowed the communities to, provide them resources so they can make these decisions themselves in terms of hunting and fishing quotas, for example. This is being done elsewhere. There are great experiences that we have seen within the country and outside the country. And these are great success stories because for several decades, people had no word to contribute to how to manage wildlife. For example, when we allow people that know the animals as well, or sometimes even better than biologists, they can make sure that these resources are enduring.
See, and could you tell us some examples of from Russia or Scandinavia that we might not be aware of in Canada of some good practices with country foods or types of country foods or Indigenous people using country foods?
In the Scandinavian countries and in Russia, there is indeed a lot of hunting, especially fishing, and also reindeer raising. And these are done according to traditional methods, and people have the required knowledge to sometimes manage herds of hundreds of thousands of animals, and to do so in a sustainable manner. For example, if you go to the northern Russia and the Ural areas in Chukotka, we have these kinds of operations that are very significant, that are entirely managed by the local communities. I could provide other opportunities of fishing communities in northern Norway, for example, where orders have been taken, they have taken over control of fishing seasons and quotas and so on, and it works very well, sometimes much better than when it's biologists from the central government that are managing things, because beyond the success stories, they take pride in the fact that their own knowledge can be used in such ways.
And what barriers do you see we could overcome in the harvest of country foods in Canada? I guess you're suggesting one would be to allow the Indigenous communities to do the regulations such as hunting quotas in their own area.
Yes, that's what I'm saying. It raises a lot of issues, though, because some of the areas that are allocated to Indigenous people with the current Canadian system are sometimes not quite sufficient to ensure food safety. So it sometimes have to go beyond that into other areas, specifically in areas where there is this competition in terms of access to resources in relation to the forestry industry. When the forests are cut down, the moose are forced to leave those areas.
Okay, do you have any comments on whales in the Arctic being used for food? I know they are in Alaska.
Yes, indeed. This hunting has been banned for a long time. It's taken up again in Alaska for the past 20 years or so, I believe. In the north, more eastwards, the beluga hunting is still greatly practiced in the Hudson Bay, in the Ungava Bay, and right now there are other species of whales that are being hunted with very few quotas. People are really satisfied, they're proud, because a single whale can feed an entire village for lengthy periods, and they can get back in touch with their traditional values to prove that they can feed themselves with very simple and healthy foods, even if they don't come from the stores.
Now, Madam Berube, 6 minutes.
Thank you, Mr. Chair. My question is for Mr. Duhaime. How can you secure resources in the Northern Territories for food purposes? Well, there are several ways to do so. In the short term and in the medium term, the solution is to protect indigenous people's rights to fishing and hunting and other uses of harvesting and other purposes. And the way to do so is to apply very simple, basic principles, but that are not always satisfactory to other users, such as the precautionary principle. Every time we are taking decisions on allocating lands for extractive industries, we have to apply the principle of precaution. If we don't know the impact on food safety or the impact on resources, we have to look clearly and closely at those before giving a green light to people, and also giving priority to food safety compared to the other activities. These are things that can be done. There are clauses of this nature that do exist in some treaties that could be implemented. In the long term, well, that's another matter. If we really want to talk about protecting access to food resources for residents of those territories, if we really want to speak nation to nation, we have to create something comparable to a third level of government in Canada with the capacity to have the management of national or natural resources. Could you tell us some more on the scope of poverty as a problem? Yes, I mentioned this briefly earlier in discussion with some of my colleagues. I looked at some of the official measures that have been prepared by the research institutions, the statistics agencies, even in the regions. When you add to that calculation the consumer price, not what we measured ourselves in our study, but figures coming from the departments, we find poverty rates that, as I said earlier, on average in the Northern Territories, they are 37.5%. I think the lowest figures we found were 27.5%, and it can go up to 47% in Nunavut. So you're talking about half of the population that is living under the poverty line. So those that are immediately above, say, maybe $10, $100, $1,000 above that line, these are not very rich people, and this does have important impacts on households. There was a study carried out a few years ago with 450 households to measure the impact of prices on the household budgets. And this is in one of the documents I tabled before the committee. For low-income households, we found that food cost represents 55% of the budget. And if you add shelter, it's 70%. So you're talking just two budgetary items. So it's a very difficult situation. There are several solutions to combat this phenomenon. We could get into that later. Now, what solutions can you propose to combat poverty. Monetary solutions. Yes, there are several possible solutions. We must take into account the high prices of foodstuffs in terms of the compensation for local workers. This is what people say every time we carry out a study. People that are hired locally don't have the same compensation and benefits as people that come from outside the territory. They have benefits to cover food and so on. And social programs often use parameters that were developed for metropolitan areas such as Toronto, Montreal, Vancouver. The people in the north are no different, and it costs sometimes 50, even 100 times more for a food basket. And also tax credits. The Quebec government, with the pressure from the Nunavik authorities, has introduced such measures, some tax credits for residents to take into account the consumer price index. And there has been a positive aspect. One of the things that makes things worse in poverty is the shelter crisis we see in the north. And this is mostly because the federal government has withdrawn from social housing construction. That it's a shelter or housing crisis in the north that has been going on for a long time. There are several solutions that can be brought, but they are not being proposed. And also to promote local production, not just based on the commercial model. The communities don't often favor this model. We carried out studies in several communities. They say, yes, we would want to trade on such items and this, but not at all costs. There are some species we would like to preserve, first of all, for food purposes, for the collectivities, and then maybe we could think of trading some of those resources later. Thank you.
Thank you so much. Ms. Blaney, you close it off. 6 minutes. Go ahead.
Well, thank you, Mr. Chair, and thank you to the witnesses as well for presenting to us today on this very important subject. I'm going to come to you first, Professor Durkheim. One of the questions that I have for you is around, you talked a lot about poverty, the impacts of poverty on people's access to food. One of the things that I've heard several times is around the Nutrition North program and the fact that it's not very transparent, and that there may be a better idea of moving it from a subsidy program into more of a social program, so that the resources are reflective of people's income and puts more resources in the pockets of people who are in those high levels of poverty. I'm just wondering if you have anything to say about that in the work that you've done.
I think that's something that could be explored. As far as the Nutrition North program itself, the transition, the implementation of this program was done or was felt in a very difficult way. In areas I worked, people felt abandoned. In fact, there was a drop in prices for priority foods. We hoped that people would consume those items. When the program was put in place, local authorities said in several areas, and I witnessed some of these, that the federal government is trying to transform Inuits into rabbits. They don't eat carrots. The favorite food for nutritional authorities in the federal government are not necessarily the preferred foods of the local population. The list of products that are developed or created to determine the subsidy rates for Nutrition North, it's some form of neocolonialism, really. We are imposing certain definitions on the communities, our definitions of what healthy foods represent. I think that some work can be done in that area. all the products available in the stores should benefit from transportation subsidies. In the stores, as you know, these are stores of a general nature, general food stores. You find instruments for hunting and fishing, and if you want to subsidize fresh fruits and vegetables, as some witnesses said, these are not necessarily fresh when the consumers come in. Why not make sure that people have the means to procure healthy food? Some of the budget limits at the beginning of the program were a catch-22 for representatives of the local communities, because they are seen within Nutrition North. These are people that are appointed to make decisions to take certain food items from the list, and that's not maybe what they really wanted to do. The representatives of the northern communities actually walked out from those committees. The program should be broadened also, and I would end on that point. It should be broadened. It's not just because there's a road link that the costs are lower. I have done studies on cost in communities where there was a railroad, and the costs were 57% higher compared to metropolitan areas. A community that is linked by a forest road, that's 8 hours by road from Quebec. The costs there are 40% higher than the closest city for reasons that are linked to the history of the program. There are a lot of difficulties in these communities, and I think there is some injustice surrounding that.
Last question for you is around food storage infrastructure. We heard again and again from other testimony that both local food storage infrastructure is a challenge, but also for stores. There's just not enough storage space for food. And there was, discussions about food being sent and then largely wasted because they didn't have the appropriate storage quick enough in those very cold temperatures, and food was lost. I'm just wondering, in the work that you've done, what you heard about food storage, and if there was any particular unique or interesting solutions that people proposed to you. And that's my last question, Chair. So thank you.
Oui, absolument. Il y a des...
Yes, indeed. It's possible if we stop looking at storage infrastructures as subsidies to business. For example, setting up a port infrastructure. What's the difference? Setting up a port to allow ships to come closer and unload, and the construction of adjacent infrastructure that would allow storage, better storage. That's what we see elsewhere around the world.
I appreciate that. Thank you very much. Thank you, both of our witnesses, and my apologies once again to Nellie Cournoyer. I would ask the committee if her submission, her presentation, could be adopted as perhaps it's not been in translation, and I'm sorry about that. But would we accept that, or shall we wait for a further opportunity to have Ms. Cournoyer's submission? Any thoughts on that?
But Chair, if we get an opportunity to have her in person, I think that would be great. So maybe as a secondary step, that's just my thoughts.
Okay, well, we'll go with that. Marcus?
I think just as a procedural item, given the fact that operating virtually is pretty new, it would seem to me a pretty fundamental denial of her democratic rights to participate in the democratic process if people like her who come from places which happen to have poor internet are not allowed to participate in things like this because of lack of ability to do simultaneous translation. So as a procedural thing, that ought to look at alternatives in this kind of situation. For example, allowing her to testify and afterwards to providing the translation in French, because I think
that would be accepting the speaking notes. So we'll leave that at there because that's a discussion we have to have. Once again, brilliant testimony. Both of our witnesses, Monsieur Duhaime, Ms. Verschegen, thank you so much. We need to leave the meeting now and come back again for the in-camera portion. We're now suspended.
Mm-hmm.